Assalamu alaikum. The communication day. First scenario, Mike Jones is a 20 years old man. He presented to the emergency department last night semi-conscious following an overdose of unknown substance. He was found in his university bedsit by a friend who think he may have taken some sleeping tablets. The bedsit door had been locked and a suicide note had been left. Paracetamol and salicylate level were undetectable and laboratory investigation were all normal. Management was supportive. He has now woken up and is asking to take his own discharge. His parents have apparently been informed of his admission, but haven't visited him. He has no other medical history listed in his notes. Please talk to the patient and address his concerns. Ready?
Yeah, I just my voice will be
Yeah.
low to simulate the tone.
Okay.
Just let me know if it's too low or I need to raise it. Just send me
No,
a
it's clear.
message, Dr. Bassem. Yeah,
Okay,
okay.
it's clear so far. Yes.
Okay.
Okay, with this level, it's okay. Okay, you can start, Dr. Muhammad. Here you go.
Hello, I am Dr. Muhammad. I am one of the doctors here today. I need to confirm Mr. Jones, 21-year-old with me.
Yeah.
How are
Yes.
you now, Mr. Mike June?
I'm okay.
Okay. I need to know firstly, how much do you know about what's happened to you?
I don't know. I guess it was. I've been brought into the hospital. They did some blood tests, and I think everything seems to be normal.
I'm so
I
sorry.
don't remember anything from last night. It was vague. Yeah,
I'm so
sorry for
sorry
that.
for you, Mr. June. And as you mentioned, yes, yesterday some of your friends brought you to the hospital, and you were your conscious level was low, and we run some investigation in the lab, and it was okay. And we observed you until you become more better and more conscious. Conscious. Okay. And please, Mr. June, what do you expect from our meeting today after what's happened for you?
I think everything seems to be normal. I would do prefer if I can be discharged. I'm sick of being in the ward with elderly patients.
I appreciate your concern, Mr. June. Regarding the room that you are there with that old people, we can arrange for this. It is we are here to help you and support you. We can
No,
arrange another room.
no need for that, doctor, to be honest. I feel better, and thankfully you've told me that
Any other
everything's fine, so I think we can um I can go, right?
Okay, Mr. Jun, I appreciate your will and your wishes, but can I know any other reason that you want to go home? Any other problem from hospital? Any other?
No, there is no problem. It's if everything is normal, I think it's reasonable to go home. Is there anything withholding me in the hospital? Like, is there anything further awaited for me? I don't know. I think if everything came back normal and I feel fine, then it's reasonable to go home.
I thanks for sharing this knowledge with me, Mr. John. But I need to tell you, despite all, but usually we are in such condition, we are keeping our patient in the hospital for a while, 1, 2 days, until we make sure that nothing of the lab or our reviews or become. And
So
I need
if it's the case, then I can come to the blood tests and the in the in the acute medical unit for the phlebotomy to take some blood samples. Would it be easier?
I appreciate your sharing with me this knowledge, Mr. John. But what's happened to you? It was very concerning for us when your friend brought you to us. You were in very critical condition, and we found some medicine there beside, as mentioned by your friend. That's why I need to ask you, Mr. John,
Oh yeah,
and
please ask.
we
Yeah.
are here. We are here to support you, and all our talk will
Mhm.
be confidential. If there is any stresses or any problems regarding your friends, family, you can share with me. We are here. We have a good team here. He will support you, and all will be confidential.
Well,
Are you with me?
yeah, I'm with you. It's nothing to tell in particular. This is um yeah, I don't deny that I feel a bit stressed, to be honest, but there is nothing to point out as as a stressor. Um, um, f from my point of view, um, I find it difficult to adapt sometime in the new setting as I'm started in college, and I'm trying my best to adapt. Yeah.
Thanks for sharing with me, Mr. John, for this. But we can help you regarding the issue. We have here a very good and expert. He can contact them, and we can help for any issue in your college, in family. And this is hard time, I know, but we are here to help, and uh, we are here. We can bypass this time. Okay? We are.
Mhm. The Well, yes. So I still don't understand also why sh should I be in hospital to do that? This can be sorted as an outside, isn't it?
I appreciate your concern, Mr. John, but uh, in some condition, when we found uh, our patient is even in is trying some to harm himself. I'm sorry for telling that.
Mm.
And, we are keeping him in our hospital to observe him more and to check we can help him. How can we help him in such issues? And
It
we
was
found
I think it's a stupid mistake that I've done, yes. But it's only the first time I did this. I do yeah, and I think we can, yeah. Do you think that I do need to be in hospital for to manage that, or
yes, Mr. June, we are usually
it's harmless sleeping tablets that I took?
that's why, Mr. June, we need to any issues for you, and that's why I need to ask you also. Are you
Mhm.
feeling that the life is still precious for you?
2 minutes left.
Yeah. Uh,
Any other thoughts you are still any other thoughts in your brain about harming yourself again? Because we found some suicidal note and you close your room, and this is very concerning for us.
it was a moment of um I I think it was like one of time, um but I don't think it will happen again.
We are happy to hear this, Mr. John. But can we have a chance to meet our mood doctor also, to sit with you? He had a very good
Is it
technique.
necessary? Do you
Yes,
think,
yes, I am hearing you.
yeah, do you think it's necessary?
As we usually practice here, in such conditions, our mood doctor here sitting with our patient, he has many techniques. He have uh, talks therapy, some therapy. He will help you and he will address everything better than and more better position than us. After that, we can assess you again and see, and he will tell us more about it is safe to be at home again, or we can follow more and resolve your issues. Are you with me, Mr. John?
Yeah, so I have to stay to meet with him, or this can be arranged outside when I'm after discharge.
I'm so sorry to tell you, Mr. John. Really, and for your safety, your health and life is precious for us. We
Okay.
usually keep our patient here to
Okay.
keep our eye to until he become very good. We assess him regularly and also following your labs again. And once we feel you are okay and our mood doctor, our feeling safe to discharge, we will be okay. We will not delay you at all. It's okay for you?
Okay. Okay. Thank you,
Okay.
doctor.
Mr. June?
Time is up.
Thank you. Thank you.
Okay, you can comment now, Dr. Ahmad, then I'll comment.
Dr. Rad, you've did well, but I think the big miss here is that you didn't clarify what tablet that he took, which is vital, and what is the source, and did he took it alone or with something else? And you can state the fact it's been written in the scenario for a reason that you need to discuss this with the patient. And the surrogate raised the concern 3 times. I've raised it 4, and you didn't answer the concern straight away. This patient will never leave the hospital, except after assessment by the mental health team. The patient is not in the hospital for medical purpose. His tests are okay. He's not in paracetamol toxicity. Every other things. He took some sleeping tablets with intention to end his life, yes. But there is no harm from he's stable and he's awake. So we are not keeping him in the hospital for um, uh, 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 medical purpose. It's for mental health team review, which is a must thing to be done if in any suicide case. The other thing is if the simulator next, once you bring this, the simulator will tell you, okay, or you can state as a final card with you that we can, we don't want to force you to stay, but if we have to, then we have the right to do so. It's covered by law. That in suicide, if the patient, even if the patient is compos mentis and wants to go home, you can use the Mental Health Act to keep him in hospital, and he will be have a security escort usually in hospitals. Uh, and if he poses risks to induce to self-harm, he will be having mittens and he will be cuffed into the bed. And they will choose a room with no windows, or that there's some certain things if the patient is keep attempting suicide even inside the hospital. But it's not the case that comes into the exam. Usually the case is, I'm sorry, can you hear me?
Yes, continue. You
Yeah.
can hear.
So this case is the vital thing is to know what's the source of the tablet. So you can just simply ask a question. Is it regular medication that you are taking, to know if it's being prescribed by his GP, or is something you bought? He will tell you he bought it. So you need to identify what's the source. How many tablets? What dose? How many? Was it alone? Have you taken anything else with it? And then he will open up. Yeah, I took it because of I'm having an exams. I find difficulty to adapt in the college. I'm living in the dorm house. And then you will ask about the support system. Do you have nearby family? Do you have nearby friend? Have you? He will tell you that the family is already far away, and he's in a university uh, place to stay or bed sit. So he find difficulty to make new friends in the new region or the new area. Okay. So you can signpost the patient, and then we will, as you've done it so well at that time. We have some help to give to you, and then keep reassuring the patient till he opens up. So usually that scenario, you either face a patient who is difficult to open up until you start to tell some facts to him. He will tell, I've took some sleeping tablets to help me sleep. Do you have difficulty sleep? How's your mood? And how's your appetite? Those are the depression questions. And why you took it. Uh, he told that I want to sleep, but we found the note, isn't it? He will tell, yeah. So, and then you've covered the other future intentions very well. But I don't know if Dr. Bassem agrees with me or not that this part has been missed.
Yes, absolutely right, Dr. Omar. Not only that, I wrote it even in the chat box. He even locked the door.
Yeah, you can use this if he
Yeah,
denies. You have another backup card
yeah,
to say, but the door has been locked from inside. There is a
exactly.
note.
So it means he's very serious to end his life, right?
Yeah,
Here, no joke. You have to detain the patient, but we will not say that. We will not say we will detain you, we will restrain you. All the confronting method, you will not use them. You will try to convince them or him to stay until he will be assessed by the mental health team, as Dr. Muhammad mentioned, Dr. Omar mentioned.
yeah.
The problem is Dr. Muhammad did it in the opposite way. He started to do this at the end. And actually, it should be done at the beginning of the scenario.
Yeah.
So you should ask about these circumstances earlier. What happened exactly? Were you serious to do that? We found the door locked. We found a letter. Did you take it with alcohol? How many tablets did you take it them together all? So you have to know exactly what are the circumstances there and why he did so. As
Uh,
Dr. Omar said, if he has low mood, means he is serious and you cannot let him go home. Whatever will happen, even the labs, the levels are normal. He should be reassessed again. Why? This patient or this man or this guy, whenever he will go home or will go to the bedside, he might try it again. Maybe he will be success in the next time, and you will be the reason you didn't detain the patient.
yeah, but this is one thing also to add,
Mhm.
Dr. Bassem, is it's just a reminder for myself to help myself to remember that in the station after greeting the patient. And in such
Mhm.
scenario, I don't think that confirming the patient name and age, it will be odd, because you are approaching the patient, you know the patient location. So, Mike, are you Mike? He will tell yes. Okay, Mike, I'm here to discuss an important matter with you. Is it a right time to speak to you? He will continue silencing or look into the ground. We don't know how the simulator acts. He might be like acting angry, or not angry, not difficult to open. Mike, is everything all right? Are you okay? And then, Mike, we have found serious things that I need to clarify from you. He will tell like what? Okay, such and such has been found. Or if the scenario has been taken, yeah, I'm fine and I'm doing well, I want to go home, then before you go home, we need to discuss certain things with you, and you can phrase what has been written for you to use in the scenario. Am I right, Dr. Basim? Or
Yes, you're right.
okay,
So
so
you have to address it in this way, but I use the confidentiality earlier. So
okay,
you can tell him, yeah, be sure that this meeting between me and you will be confidential unless it can harm others, so it might be informed to other team accordingly. He can open up, as Dr. Omar said, and he will tell you exactly what happened and what stresses he has, why he did so. If he deny that, you have to tell him honestly and frankly, we found the letter and we found the door locked and so on. Why? Because again and again and again, this patient shouldn't leave the hospital for any reason.
yeah,
Can
Okay?
I comment, Dr. Basim?
Yeah.
طبعا I appreciate this notes to remind us,
Mhm.
but I attended this case before. Okay, so
mhm,
uh, I remember طبعا long time I attended, but I remember the candidate start by you have did. The candidate tell him no, I didn't do this. It was by mistake, doctor. Why you are telling me like this? He will block the case and you make you mental block from the beginning of the session. So the mentor at this time advice, take 2-3 minutes, no problem. Make him be comfortable with you. How are you now? Yeah, what you know about your condition, as we did. Then he will start to tell you, I want to go home, I am now okay, all lab is okay. At this time, you can start to be more serious. We found you on such serious condition and your friend brought you some tablet beside you. Then I am not telling Dr. Basim, I am commenting. At the end, you can tell us the right. Yeah. But that was the declaration or liberation of the case. Give 1 to 3 minutes, make him more close for you. As we did, يعني Dr. Omar started to talk from himself. And I told him from the beginning, how are you and everything, and what your expectation. Make him like like normal session. He's a normal patient. But when he started to be, it is like mistakenly, I started to be more serious with him and tell him gradually that we found this. Started to tell and started from the beginning. Also, I told him any stresses, any problem you're with family, with friends, like this, and they started to tell from himself. I have this. So after that, maybe I should earlier tell about you trying to harm yourself and this concerning for us and this. That's why we need to observe you more and more. And I started support early. If anything he want, we can resolve it. And from the beginning, he gave me one concern. He tell me the room without telling him why to leave. He told me the room with all the people and can't sleep. I can't like this. And Dr. Omar is right. I should tell him after mentioning the tablet, this details how many tablet it was prescribed for you or not. I think this missed from me. But
Yeah.
in my opinion, the beginning should be like this. You should
Okay.
make him more close for you. Don't start by you have did. He will block the case. He will.
No, I didn't say to mention that he did so and he did so. I asked to know more about the circumstances. Don't tell him you did so. You can ask him, how was the mood, what happened there? Can you tell me more? Did you take
No,
it with another medication? What pills
no,
you
this is
take?
in the second step, Dr. Basim, not on the first. On the
Okay,
first,
I'm
I
afraid, so
remember
Muhammad,
very well.
sorry to interrupt you. I'm afraid you'll not have the time to ask
Uh,
these questions as you miss in this scenario. You miss it, right? You miss this part, as Dr. Omar said. And if you miss this part, means you didn't assess the suicide attempt itself. Was it serious or not serious? If it was serious, you have to detain the patient based on the circumstances. But if he is
No,
not
I
serious, he
mentioned,
just
Dr. Basim, about you put the suicidal note and you put when he become telling it is a mistake and it is like this. I started to tell him, we
yeah,
found.
but it was late. My point, it was late.
Yes, 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 it was a little late.
Yeah,
But
in the exam, by the way, in the exam, you might even forget it if you miss or you didn't start with this thing. This is my approach, as I said, and everyone has his own approach. I'm not forcing, I'm just trying to guide to do this or to do that. Everyone, if he is comfortable with another approach, he can follow. I'm not forcing anyone here, but I want you to know that the time will not help you to give the time to the patient to be relaxed and to give you time to be open up. No, from the start, you have to know, is it serious or not? Why? Because the task will depend on these circumstances. Is he serious? So I can detain the patient until the mental health team will assess him. Why I start with this? Because he will argue with me after I will say that. He will tell, no, doctor, I will not wait for anyone. What you will do? You will try to convince him the other minutes. If the time is borderline, maybe you will not convince him, and you mean maybe they will fail you because you didn't ask the patient to stay or to convince the patient to stay until the mental health will come. Again,
and
it's yes.
another question, Dr. Basim, why
Okay.
you need to confirm it is serious or not? The the
What do you think?
the note, the scenario itself, you tell him when
Yes.
he
And he
started to
denied
tell
it.
basically,
And
we
he
found
denied it.
the note, you found to close the door, we were trying to harm yourself. Okay,
And
يعني you
he
need to
denied it.
confirm from him like this because he already خلاص the scenario tell you he was serious.
Yes,
And
but I
you
had
put in your mind from the beginning that he will be in the hospital. And I didn't give him any chance to be out of the hospital.
But
yes, Dr. Mohammed.
can I just add something?
You,
Just quickly for when he is asking, when the surrogate is asking, shall I could I go home? It's for you to tell no. You still need to be admitted for the mental health team to assess you. Once you phrase this, the surrogate won't mention this again, and he will raise different concerns because this
You
is
know
the
the
main
answer to
concern.
this scenario, Dr. Omar, when you will tell this from the beginning, the scenario, it will not be like you did with me. He will tell you, you thought I am mad. He will be very aggressive with you.
No, no,
It,
no.
yeah,
It's
and
not.
at the end, I bring it for him by mood doctor. Then if he started struggling, I will, my last gun that you are by the law, you will be in the hospital. Under mental health act. But this is my last gun. But already you are, يعني alhamdulillah, you were
yeah.
be with me. So why I tell him, Allah, you will be under mental health.
Okay. Okay. It's a matter of showing the examiner that you are assessing the capacity from the start. You are assessing the suicide attempt from the start. And based on that, you will detain the patient or you will let him go home. Plus, you have to mention the seriousness of the condition. What happened now? Yes, the medication or the level of the drugs in your blood now is okay, but I'm afraid to say there is delayed effect. It might harm your kidney, even it might hurt your liver.
No?
We
Although,
mentioned Dr. Basim, but
Yes.
without telling heart or kidney. I mentioned sometime
This
at the beginning the level
B11.
will be okay, but later on maybe change it. We need to review it again. We mentioned this, but I didn't mention really the heart, the liver, kidney should be mentioned also if he
yes,
started struggling with us. Right.
exactly. The seriousness of any condition, they will write on your comment that you didn't tell that. You remember our scenario in Alex, right? It was about paracetamol. The comment, one of the comment was there. He didn't explain the seriousness of the condition, although the paracetamol level was in the target, right? You remember our scenario?
Yeah, طبعا sure.
Yeah. So they
I think you
commented
will
that
put
you
mark in this
didn't
scenario, Dr. Basim.
explain. Yeah, you didn't explain the seriousness of the condition itself. Paracetamol is not only the drug of the on time side effect. No, there is later on side effect. It might even terminate your liver. Even it might threat your life. So
Uh,
you have to mention it. Why he will think about leaving the hospital many times before he will decide I want to go home. he will decide after he will know that the medication
It is
is
one of
very.
your gun, Dr. Bassem, right? It is one of your gun.
Yeah, yes, I'm saying
That's why
you missed this part. That's why you have to mention it. Yes.
Dr. Omar is mentioning no need. No, it is needed really to tell
No,
him
no,
that
it's
But the
need.
patient,
you need to review the
yeah,
lab again.
yes. But what I was telling, I'm sorry to interrupt, that I'm not resisting to stay in hospital. I just want to know why.
Okay. Yeah, this is the reason.
This is a different.
Yes.
This is the concern. He's
Yeah.
concerned because he needs to know why he still have to stay with old people on the ward, and instead of being outside, and he can do يعني and I tried to prompt you that I'm cooperative with whatever test, with whatever everything,
Yes.
because
Yes.
this the surrogates or the simulators, sometimes they do have the broad lines that, and some, it depends on how the candidate interacts with him. Maybe I adopt certain like criteria in my mind to go through, and there is a different colleague also who does have the same, so he will, it won't be like ABCD approach like the medical scenarios. I don't know, Dr. Bassem or Dr. Abdal, you've been in the test before, so you can confirm that.
I remember Dr. Bassem, I started by this first gun for us. I told him we need to review your lab. We need to see. Sometime it is come normal, but later on it changed. We should add at this time, you may harm your liver, you may harm your gut. We need, your health is precious for us. Still he is telling, no, I need to go, everything is okay. And he answered me very intelligent. He told me, okay, I will come for lab. At this time I started خلاص, I upgrade my guns بقى to tell him, we found this tablet beside you, you were trying to harm yourself, you're afraid such condition, we are keeping the patient with us to observe and make the mood doctor sit with him, and he has many technique and make like this. With this time we should tell that he was serious in this. He was. It is not a mistake. If it is a mistake, he will not put a suicidal note. He will not like this. So we are need to keep you there. I expected one concern here. Really, I was waiting for this concern to tell me, and because it's written in the scenario, he will tell me. He should tell me. I think, and I attended like this before, and it asked for me. Doctor, please don't tell my mother and my mother what happened to me. At this time, he has the autonomy you are sure that he is retaining the information, repeating it, and he know, and he will be in the hospital, تمام, and accepted the last concern with him, please don't tell my mother, and he has the right to not tell as long as his mental health or capacity by you observe it well, and he's okay, and he accepted to try in the hospital. You are with me, Dr. Bassem?
Yes, I can hear you.
No,
I think this was one
yeah.
concern, and a very important concern, because you can tell no, and you will against his autonomy until the Mental Health Act see him again or assess
Yes,
him.
definitely. You cannot tell his father or mother because he's 20 years, right? The age, how much?
Yes,
Uh,
he has
he's
autonomy. No, 20 years one, he has autonomy.
Yeah, 21. So yes, it's never happened. You cannot tell anyone.
Yes.
Okay.
Uh,
You want to add any comment, Dr. Omar? Yes, sorry.
no, it's regarding the last question or this concern, if it has been raised. Um, of course, you wouldn't tell, but why this concern needs to be asked in such scenario? Like, is it in all scenarios should be raised?
no, I think once he mentioned any full sentence in the scenario, expected that there will be a concern there. That's usually like this. Why he mentioned his father and mother if he don't want to raise this concern?
No, it's been mentioned to prompt you to ask about his family. Where is his family lives? Are they
Yeah,
nearby?
this is another part in the scenario. I think is supposed to be done after 2 minutes left to ask about with whom he's living and how is his family, how the
I
support
asked
from
him,
his
Dr.
family.
Bassam, about this. I asked any family issue, any problem.
Okay.
Family issue, there is no family issue, but his family is in a different town. You get
Yeah.
what I mean? So
Maybe this is a reason. Yes, also another reason.
like he's in college, in a college bed set, so he's with sleeping with
He's
other people that he didn't used to.
so he's
Um,
alone.
yeah, he's
Sound,
alone.
yeah.
Yeah.
Sound he's alone. Yes.
Yeah.
Yeah. Okay. I think yes, it's a good discussion. By the way, everyone will understand how this scenario will be derived. As I prefer to do it in my favorite way to start confidentiality and the circumstances, and later on you can know from the circumstances that this happened as serious one or no. If serious one, never ever allow the patient to leave or go home unless he will be assessed with the mental health team within 72 hours. So he will be staying all this time. During this time, the patient will be reassessed, check the vitals, check the liver function test, the drug level, and whenever he need any antidote, he should receive immediately.
And and I think in this scenario they've mentioned only sleeping tablet for you to know what type of sleeping tablets that he's taking, what it is. If you've
It's
been
okay.
asked,
Yeah,
yeah,
yeah.
yeah.
So you will know what have you taken. You have to ask this. It's not history taking. In this scenario particularly, you have to ask about the circumstances, what you have taken with the medication, how many pills, did you take it with another pills? All this thing will give you a clue that this patient was very serious or he just pay attention or try to pay attention to others that I want to kill myself, but I will not do it. Once this happened and he, or by mistake, for example, or he took it instead of other medication, if this happened, so it's not suicide attempt, you can reassist the patient, but you will not let him seen by the mental health team. The difference between both scenario, the one with the serious suicide attempt, he should be detained and offered and be consulted by the mental health team to have a look to the patient. And the other one, no, he had the capacity. He can leave whenever his situation is okay. Drug level, the liver function test, after explaining that the delayed effect, sometimes the kidney might be injured. So please stay here till you finish your antidote. If he's agree, okay. If not, give him red flags, let him sign DAMA paper, and let him go home after red flag explanation. Anything will happen, like dark urine or dark yellow in your eyes, tummy pain, tummy discomfort, all the things, please visit us immediately. Okay. This is the difference between two scenarios. But our scenario today was suicide attempt, so the patient should be detained. Okay.
And there is a similar scenario, but you are talking to the mother of the patient or the relative of the patient. So I think
Yes, you
if
will not tell the details of suicide. You will just tell he admitted
mm,
because of medication he has taken. What purpose? We are not telling you. This is his confidentiality. We cannot tell you.
yeah, no, there is another scenario that has came
Mhm.
where the mother is asking to discharge her daughter after the
Yes.
paracetamol toxicity, and she
Yes.
thinks that she will provide her best support at home and stuff and etc etc.
Yes.
So usually we will state and phrase that she needs to be assessed at the mental health, but by the mental health before any discharge to see if there is any kind of support she might need and stuff like that.
Yes.
Yeah.
Exactly. And you have to stress on this part. If the patient or the daughter left the hospital without being assessed, it might affect her job career because she left or discharged against medical advice, and this can affect her future and career in the job, right? Because you cannot leave the patient, let the patient go home, and she need to be assessed. Why? She might come back again with another suicide attempt and again, and this thing will affect her job. So she should be assessed and treated properly before leaving the hospital. So you cannot follow the mother request. No, I'm so sorry. Your daughter should be seen by the mental health team. By the way, we discussed all these scenarios in the previous sessions.
Yeah,
Maybe
I didn't.
couple
I
of
didn't attend it. That yeah.
yeah, a couple of months ago. Okay, thank you, Dr. Omar, for this scenario. Let's move to the next scenario. 38 years, Mrs. Nadia was admitted to the hospital by rectal bleeding after doing colonoscopy. She has been diagnosed as familial adenomatous polyposis. She is coming today to know her result and discuss her further management plan. Please sit with her and address her concern. Whenever you're ready, Dr. Omar, let's start. I'll try to read the comment quickly. Dr. Bassem, how will we know that it's a psychiatric case of depression, suicidal attempt, or toxicity? As paracetamol toxicity can show the changes in the 48 hours as he came 12 hours, how to know that? So it depends again on the circumstances, not on the level. Okay? You have to know why and when and what are the circumstances patient have taken this medication. Was it alone, with medication, with alcohol, lock the door, written paper or letter, he called for help. All the things means if he do so, means he was serious and he was about to kill himself with a serious way. If no, no, he didn't lock the door. He didn't take it with alcohol. He didn't take it with another medication. So you can say it was by mistake, or he will tell, just I have a fight with my husband, or she will tell, I have a fight with my husband yesterday. So I try to pay attention. Just drama, I mean. Okay. But once you have positive finding, this patient is serious, maybe he will come again with a serious condition of liver failure or fulminant hepatitis, as we know, due to paracetamol toxicity. So don't let him go home. I hope it's clear both the scenarios or both ideas. Either detain and offer for mental health team, or he can leave and he will be just instructed for the side effect in the future. Of course, after normalizing the level and the monitor of the vitals, liver function, everything were okay. Okay. But if he insists and he is fine, he has the capacity, everything is okay, the drug level is low below the normal, and he received the antidote, for example. One scenario came as 10 hours remaining to finish the antidote. So you will try to convince him to stay for the 10 hours or the rest of the 10 hours. He will argue with you, but again, he has to take this level or to take this antidote until it will be finished. After that, what will happen? We will reassess you. What if he leave? You have to warn him that you might have delayed side effect on your kidney and in your liver. However, if you feel any side effect or if you feel any change of the color of the urine, please visit us immediately. And after that, if he insists, he can sign demo form, discharge against medical advice form, then he can leave. Okay, this is by mistake. If he took the medication by mistake. Okay, otherwise, all these sessions, please, if anyone interested to hear them, it's collected in the practice case. Paracetamol toxicity, all the situation we discussed before. Anyone interested? Maybe I will share it today or tonight, so you can hear the old situation and the old scenarios. Looks like our scenario today. Ready, Dr. Omar?
Yes, ready.
Okay, here you go.
Hi, hello, Mrs. Nadia. Yeah, I'm Omar. I'm one of the doctors here in the clinic today. Can I just confirm your age, please?
Yes, I am Miss Nadia, 38 years old.
Miss Nadia, I do understand that you are here today to know about your camera test and biopsy result.
Doctor, I came to the hospital with some
Mhm.
bleeding in my large gut, and they do this camera test, and they told me there is something concerning there.
Yes. So just before start telling the result, I would like to know if you want someone to be with you. Did you came alone today?
No, doctor, I'm okay.
Okay. So, do you want to start um, by just to make sure that I am also with you on the same page, um, uh, um, to start to explore some background of this bleeding, or you want me to start by telling you what's the discussing the result, whatever you like.
I don't know, doctor. I know that I have some bleeding. They
Mhm.
control the bleeding by camera test, and they told me to come today to discuss this issue.
Yeah.
I don't know. Please tell me what's happening.
So when you've had the camera test, they told you that they are concerned, aren't they? During the day when they did the camera test.
Yes.
Yeah. So for from what have resulted or written in the results, they found some multiple growths in your large bowel, and they have tested the large bowel that tissue that they sent, and it came positive for a condition that affect the large bowel. They call it um, familial adenomatous polyposis. Have you heard about it?
No, doctor. It is something serious.
It is. It carries. I'm afraid to tell you this. Yes, it is serious. Yeah.
I will die, doctor.
It's not the case at the time. No. It it carries potential risk, high potential risk for cancer, and therefore we need to start looking forward how we can what we can how can we manage it and what we can help you with.
My God, it's shocking for me. It is cancer, doctor.
From what it is resulted, yes.
What you will do for me, doctor? I am enjoying my life. Please help me.
So I would like, in order to address the management, I would like to ask you a few questions if you don't mind.
Yes, doctor, I am ready. Tell me what you.
Yeah. So since you had the camera test till now, have you experienced any significant bleeding, or
No, since
everything is
time
stable?
I am okay.
Okay. And in your family, is there any similar cases in your family, runs in your family for cancer colon?
I heard before one of my family had this has this problem, but I don't know what was the diagnosis. It was a cancer.
Okay. Is he from your father's side, or from close family member, or second degree relative, for example?
It does matter, doctor.
Mhm. Okay. On the other side, now, um, do you smoke?
Please, I need to know what you will do for me now. Uh, Smoking, I will stop smoking, but tell me what you will do
This
for
is
me.
this is good. For now, what we will do is that we will refer you to our oncology team, and also the gastro abdominal surgery team or tummy surgery team, to have a look on the results first. Second, we will also do they will might request further scans to be done, and then the likelihood I'm talking in general, usually the colon will be resected. Resected means it will be cut out or removed in order to prevent further or risks of high-grade transformation to significant cancer. Are you with me, Miss Nadia?
It's very difficult for me, this news.
Yeah.
He got my gut, doctor.
I'm sorry, I didn't hear. Can you repeat again?
There will be cutting for my gut.
Yes. This is how it's usually managed to remove the colon. And when they do that, or your large bowel, when they do that, you will be, of course, you will need to be admitted in hospital for a while, and then further steps will be taken from there. Is there any particular concern into your mind about surgery or about what I've told you?
Yes, doctor. I remember something now. You are asking about my family and my in history of my family. That's why they
Mhm.
took from me some test, another test. I know
Mhm.
now it's a genetic test. So they took it from me without my permission or without explaining for me. I will
No, no,
complain
no,
this
no.
hospital.
I didn't think that what is written in front of me says that, but however, if you felt you need to complain about anything, we can provide you with the details of the pulse. It's the um, uh, a committee that deals with the concerns. But on the other hand, the other thing that we will refer you to is for genetic counseling. So they will talk with you about the possible inheritance
2 minutes left.
of the disease. But I don't think from the information in front of me that you've been tested for genetic, you did had a genetic testing.
Yes, doctor. I am sure they take from me some testing, but
Okay.
they didn't explain for me too much to know about this.
Okay. And if it's the case, then it would be something needs to be addressed. And I can refer you today to the Pulse team to assess that.
Okay, doctor. For now, if they cut my gut, I will be cured.
Um, High likely, yes, because the growths are within the colon itself, and it's the what it causes. It's the reason why you have the bleedings. So if it's taken away, you will be surveilled, like followed up for any potential growths after that. Do you have any other question?
What about my family, doctor?
The family, the genetic counseling team would address that in very further details. They need to trace how many members of family you affected, and also your children. Do you have children?
Yes, doctor. I have two.
Okay, so they will be also have the genetic testing for that. Genetic testing is something different than the tissue biopsy which you had.
Yeah, doctor. Thank you.
Thank you. Thank you, Miss Nadia.
Okay, time's up. You can commit now, Dr. Muhammad.
Okay, doctor. Very good, Doctor Omar.
Mhm.
But the entrance of the case was not so good. And you told her you have a cancer, then what about smoking? This I think never to tell like this. If you tell cancer, and it is not cancer, طبعا, it is it is gross only, as you mentioned,
Mhm.
not a cancer. You are telling her Yes, as you mentioned from the beginning, the result now in my hand, something concerning there. We have some condition called directly family Adenamatous Polyposis. Do you know about here, as you told? No? Okay. I will draw for you. This is your gut. It's 100 of growth there. This is the cause of your bleeding, and they control it this time. But we have a problem. This process mostly it will turn to cancer anytime. So we need
Hmm?
to do some intervention for it. I'm sorry to tell you, mostly we need to remove the whole gut.
Yeah.
And wait, wait, you are giving her some shocking news. Then she will tell you, as we mentioned, the horrible doctor. Can I continue?
Dr. Abdelal, your sound went a bit and then came back. Can you repeat the last sentence? I didn't hear it.
What last thing you hear? You hear?
Uh, was the last thing was to wait and to stop. You are
After
delivering
telling
her shocking news. Yeah.
here, yes, after telling you here
Mhm.
the definition of the disease and it here about this process, I am sorry to tell you this will be mostly will turn it to cancer. That's why we need to do some intervention for it. And I'm sorry to tell you again, most of your gut need to be cut. Then wait for her back to take the shock news. It is not very bad news, but partially bad news. Yeah, she will be shocked because you are telling something serious for her. And then can I continue? Okay. After she can tell you if you remove my gut, how I can do my regular bowel motion. Can't it still exist? But you don't wait until that. You draw for hair after removing the gut. There will be some opening in your abdomen, and this opening will be connected to bag. This bag will be containing the bowel motion, and you will refer you to the specialized nurse. She will teach you more about that in another setting.
Mhm.
You will طبعا started to uh, maybe ask you after that I will be cured or better also again continue you from yourself. Can I continue? You are with me? Yes. We will follow you again after that. And the remnant part of your stomach and large gut will be screened again, sorry, every while to see if there is any other growth there. The very serious disease, but by following it and screening it as early as possible, it will help us to manage. And after that, she will tell you when you ask it here, if you started to mention about we need to refer you to the because this disease is a familial disease and it runs in the family. We need to refer you to a genetic counselor. At this time, she will tell you, this is the test that you take from me and without explaining for me this is a familial disease. As you mentioned,
Mhm.
how to know it is a medical error or uncertainty or as long as not mentioned outside anything the surrogate tell for you, it is not a medical error. Okay,
Mhm.
okay. If she shocked you with this question, I am so sorry. Not sorry. It is not usually. This is not the usually we are doing. We are usually discussing the patient before giving this test or starting this test about everything. However, I apologize for you. We will, if you have been not told or explained about it, we will look into it. That's one sentence to finish this. As long
Mhm.
as not mentioned outside. If mentioned outside, it's a medical error. That not he will mention clearly. They took genetic
Mhm.
test without explaining. At the end, again, I'm confirming in you. We will refer to genetic counselor because there is 50% chance for children to have this disease. So any pregnancy to be planned and to help you in decreasing the chance of this. I think no need at the end to mention any social, only support. No need smoking alcohol because she is angry. If she become okay, you can start detailed social. But the main is planned pregnancy, and social support for any social support we care, affected job, what is their job, and only support only. This is the main issue.
Mm.
If it is cooperative with you, you can mention better to avoid alcohol. This is my comment.
Okay, thank you, Dr. Mohammed.
You did it very well. Only the entrance of the case, it is not. This is a false information. It is not a cancer.
Yeah, yes, I
After
agree.
you telling
Yeah,
it,
yeah.
and after you telling her a cancer, you started to tell her about smoking. So how come never to tell smoking without cancer? It's cancer. خلاص, let her until we.
No. In potential cancer cases, we need to also to clarify if the
Yes,
patient
still.
is on smoking or not. This is what I know, but it's
Yes,
fine.
still smoking to be addressed, Dr. Mohammed. What the problem if he
Not
address?
Dr. Bassem, not in the same time. He is still here cancer. Are you smoking?
Okay.
No, it's not like this.
No.
You can't address at the end, not at the beginning. No. If I am a surrogate, I will be so angry. You are telling me
Okay,
cancer.
it's
You
my
mean
point is need to be assessed, addressed, but not early. Okay.
yes. I am.
Yeah,
I would like
maybe at the end, Dr. Omar, as 2 minutes left, you
for
can
Dr. Bassem.
address
He
it.
is become comfortable.
Yes, exactly.
Yes.
And I think Dr. Omar, he has good way as written. One of the doctors written good comment. Yes, you are comfortable, looks comfortable, but you have to speed up your flow of rate to talk fluently more because you have a lot of tasks. In the exam, by the way, you are like running, and the time also will be running. They're not waiting for you to finish your task. Once the bell is ringing, you will enter. Once 2 minutes left, they will tell you 10 minutes, it's full. So the time will be up. If you didn't address all things, the task, the explanation, they will not give you a chance. Okay, so please just to practice more nowadays. I know your exam next week, but as much as you can, try to practice to be more fluent and more quickly in the answering and asking the questions. And as you know, also the accent there in UK is very difficult, and they are always talking fast. So please try to be as fast as you can. This is the first point. The other point, yes, it's wrong explanation about the cancer, which is not actually you mentioned it potential cancer or potential to be a cancer, but later on you mentioned it's cancer. So yeah, don't be hesitant. And once it's not written as a cancer, don't say it's a cancer. Is it breaking bad news? Yes, there is a way to break bad news. It's not good news. Why? Either it will be cancer, which is bad news, or they will remove the gut as a colectomy or curative colectomy, which is also breaking bad news. It's not good to have total colectomy, okay, with colostomy. So for me, it's breaking bad news totally. Golden silence and the breaking as breaking bad news, golden silence and warning shot. Okay, use it always with this way. The other thing that's jargon. You mentioned some jargon like oncology doctor, like you corrected the tummy surgery doctor, which is good. You can say also gut doctor. Okay. The other thing, yes, the cure. You mentioned the cure. The diet here you can refer. You mentioned a very good point when you mentioned we will refer you to a group of doctor, not only doctor, group of doctors, including the dietitian. They will let you know about the proper diet and also, as you mentioned, specialized nurse, cancer doctor, the gut doctor, the surgery doctor, to educate you how to deal with this. Along with the genetic counselor team, they will sit with you to screen the whole family because it's very dangerous. If you are planning to be pregnant, we have to do it as a planned one. Okay, at the 2 minutes left, you can ask about the support, the smoking, the alcohol. All these things might increase the risk of having the cancer. Female in the childbearing age, you have to ask about the pregnancy, as I mentioned. About the mistake, doctor, they did for me. I'm so sorry. This is not our usual habit, and if they did do so without your approval, please accept our apology. This is a mistake, and we will report that immediately to know what exactly happened. We are sorry on behalf of the whole team. Okay, this is the whole summary in this scenario. You want to add any question or any comment, Dr. Muhammad?
No, Dr. Basim,
Okay.
I think all points
Yeah.
expressed.
Okay, Dr. Omar, you want to ask any question?
No, it's about to clarify the smoking. When I clarified the smoking, I signposted or
Yes, yes.
the that I'm asking a bit about her background. Does it? Do you have any family member? Do you smoke? So those are the things that we in order for you to manage in the management, once you
Yes.
touch down with the management to mention the smoking cessation referral,
Of course, you
if
have.
she
By the way,
this is when I didn't tell
yes,
cancer. I
yes.
didn't feel that, but
No, no,
of
it's
course you
okay.
were listening. Sometimes it
Maybe,
might feel
maybe
different
Dr.
to me.
Maybe Dr. Muhammad is trying to direct you to the end of the session to address these things, not earlier. So you have to finish the task first, the explanation of the disease, how much it runs in the family, and who can affect what can happen, what the complication. Here, even you have to talk about complication. It might be a cancer, it might have a hole, it can lead to injury to the bowel, and so on. Constipation, all these things might happen. Blood in the stool. You have to talk about these things, and here you can. It's accepted to have a family history. Why you can ask? Because it's called familial. So I have to know about the family. Who else is injured or diseased with this gene or with this condition? So here you can ask as you did. Familial, I have to take family history, even with the details, the age, and the how old, the generation, because I should screen the other. Why I can do curative colectomy? I can remove the part of the colon which can in one day turn to a cancer. Clear?
Dr. Basim, I need بس Dr. Omar to revise the recording. تمام؟ I am not telling, not addressing this. But if you
Okay.
see,
Yeah.
cancer, you told the cancer, and it is still not explaining everything. She don't know what's going on. She was in shock. Then what about smoking? What about your family? You didn't absorb the patient at the beginning, and this is, I think, not right. يعني, in my opinion, if you revise the recording, it will be clear. She is still in shock, and you are telling her, please, you are smoking. يعني, what's the
It's
benefit now?
okay. It's okay. We are just trying to advise everyone. Try to make it in that proper time. That's it. Okay. I have good comment in the chat box. Thank you, Dr. Muhammad. Dr. Dina, do we need any consent regarding what? Consent for the genetic counseling? Yes, you have to do consent. For the surgery, of course, you have. Or you mean consent initially to talk about the condition of the patient? Yes, you can. Here also, either to invite or not, it's okay to support. Sometimes some disease as a genetic or familial condition, it's not preferred to ask or to invite someone unless the wife, for example, agreed for that, or she want to be allowed to attend with the husband, for example. But such disease, maybe some persons will be feeling, no, I need more privacy to know what I have first, then I can share to my partner. Okay, so Dr. Omar, it's not something to be advisable to invite someone for genetic counseling session. If she accepted earlier, you can later on, or you can tell her about that. Then, if you need to share this information with your husband, we can share. We have another meeting with him. Dr. Kani, why do we refer to a cancer doctor? It's high risk, not yet transferred to cancer. Family will be under surveillance. I agreed to not to mention, but you can mention. Why not? You don't know what exactly ongoing, how much the percentage. We have to know what are the percentage of the polyposis in this gut. You don't know what are how many family member are there. What the problem if you refer to the cancer doctor? It's high risky to be, yes, transformed to cancer, but if it's okay to invite the cancer doctor, it will not harm it. This is what I mean. Okay. But the surveillance, yes, could be there. The surgery could be done, whatever the cure or the management plan. But you have to refer to multidisciplinary team approach. A group of doctors. One of them could be the cancer doctor. Okay. It should be mentioned as it's autosomal dominant. Okay, you can mention it's running in family, and if he asks, if not, you can say only run in family. Some surrogate, he will ask you how percentage it runs in family. Some others, he doesn't care. Runs in family, that's it. If they accept or if they ask you, either to be sure about the percentage and to will say 50%, or if you don't know, tell her, I want to confirm this with my senior. I will refer you to the genetic counseling team. They will address this appropriately. Okay. Any other question? Okay.
No. Yeah, I think
Yes.
that I just wanted to add one thing because in the scenario it is written that based on the colonoscopy, the patient most likely obviously has been labeled as familial adenomatosis polyposis. So one thing is that it wasn't clearly mentioned that whether the biopsy was done or not because it could just be a colonoscopic diagnosis and they most of the time when they do see polyps so they do biopsy a few polyps just to make sure that there is no underlying cancer. So cancer has not been ruled out. So this is something obviously which wasn't clear in the scenario. So if not clear, I think it could have been addressed that uh, I mean, obviously, this is a condition which is a precancerous condition with 100% risk of developing into cancer. The other thing was regarding the management. I think when the patient asked, is it something curable? And the candidate said that, yes, it is curable if we resect the. But you haven't done any further workup up to this point. It has already, I mean, you haven't got any results of the biopsy, whether the cancer has already developed or not. So the first thing is to confirm whether it is are these just the adenomas or they have transformed into a cancer. So once that being done, then you know you need to know the do the staging CT just to see if the patient already have a metastasis, suppose in the lungs or in the liver. So at this time, I think it was premature to say that the colectomy will cure the problem because you are still, I mean, in a kind of a early on in the scenario and you don't know that what it turned out to be. So I think saying that colectomy will cure the problem perhaps would not be an appropriate statement. And then regarding the genetic testing, you need to tell the patient that the importance of genetic testing, that why it is important, and just to counsel them up on the genetic because there are certain genes which might be associated with that, and you need to tell that although this has we have picked up in your case, but obviously your family member is also at risk, so we need to, and this is important, that we need to start screening about them as well before they pick up the problem. So I think these are the few things I feel that the cancer obviously was not clear. So generally if you don't have a clear cut diagnosis of the cancer, most of the time the oncologist will not be interested in looking at the patient because it is only once you have, because oncologists are not going to do the biopsy, it has to be done by the gastro team or the endoscopy team to confirm the diagnosis. Once that is confirmed, then you can involve the cancer team and then take it from there. But I think that at this point, I think it's just a premature thing to say that I will ask the cancer team because you don't have any evidence of the cancer. So precancerous does not mean it is a cancer. So you just need further clarification and further confirmation. And also after that, you need to have a staging to find out that where you are, and then you can formulate a proper plan. So this is my understanding of the case.
Okay, thank you, Dr. Hisham. It's not clear actually in this scenario. I don't think they will bring scenario in three lines as in this scenario. So whatever it's written, you have to explain. We don't know. Even me, I don't know. We just talk about familial as a condition, familial polyposis, adenamatous polyposis. So is it a cancer? It's not clear in the scenario. Is it metastasized? We don't know. The patient just have the condition, and we don't know what exactly the patient is having. But if early stage, this could be curative. If late, So we'll not talk about it because it's not there in details. I don't think
Yes,
you
this
can.
Dr. Basim, this is my point. Yeah, I agree
Yeah.
with you.
So
This is
yes,
what
I
I'm saying
agree.
that
Yes, I
Dr.
agree. But
Yeah,
it's
Dr.
I
Umar
cannot
said
say
to the patient that I'm sorry, this is a cancer. So I
yes.
think
But
this is something obviously which was quite a because whenever you are committing someone or saying
yeah,
someone in the exam scenario that you have cancer, so be ready for response from the examiner because generally unless and until you are not absolutely sure, then you need to be a
yeah,
little bit more diplomatic. So here rather I would prefer saying that it is something which is a precancerous. There's 100% risk, lifetime risk of developing. We don't know yet about the results of your SNP test or your biopsy. So just need
yes.
to wait for that. So I think that
Mm.
it was just a little bit premature to just tell the patient that it is a cancer and it is a curable. So I feel that these two statements would not go well with the examiner, then likely to deduct the mark on these two statements.
Yes, you're right. Okay. I think it's also again related or depends on the scenario. In such scenario, don't be in details. Don't give more information which is not mentioned. Be stick to the task. Try to be as short as you can regarding the details. If he asks more details, you can refer to the senior or refer to the group of doctors. They can update you about the management plan, further management plan. Okay. Thank you, Dr. Hisham, and thank you, Dr. Muhammad, Dr. Omar. Thank you all of you.
Yes.
Anyone have
Sorry,
questions? Yes.
sorry. Good evening. So,
Yes.
I think
Yes,
I
Dr.
think
Khalid.
this scenario can go two ways. It could be just the FAP, and I think in this case would have just said, "Oh, there are lots of growths in your gut, and which can go two ways. But now we don't have the result of the tissue that was taken. So we'll wait and have a look. But with this multiple growth that is there, the management will be colectomy and everything till we get the diagnosis. I think it can go in two ways rather than just saying it's a cancer. Just let the patient know that it's FAP, a lot of growths in the guts. And then I think the surrogate will now push you the way they want us to go. Thank you.
Yeah, yes. Thank you, Dr. Kani. It's 100% agreed that it's not yet cancer. I mentioned that it could turn to a cancer in one day if not properly followed and surveyed, as Dr. Omar says. So we will follow up you. There is possibility to be a cancer, and other way we can also remove your gut in order not to have this cancer. So it depends on the percentage of this polyposis or polyps. We don't know what exactly the surgeon will decide along with the gut doctor, along with the surgeon. Okay, so it's a multidisciplinary team decision, not yours at all. Don't mention the decision by you. You will be referred to the group of doctors. More details will be in the meeting with the group of doctors, or next meeting will update you whenever we are sure about what you have. But there is possibility to be a cancer. There is possibility to be cured by surgery. There is possibility to be just followed up. Okay, all the things depends on the scenario. Thank you, Dr. Kani. Anyone want to add comments before ending the session? Okay.
I think.
Before, yes.
I'm sorry. Yeah, I continue, Dr.
No, I want to add just a note for this week practice because I had a lot of requests. I will cancel the short station. So we will do long communication, long communication, long communication in order to give more opportunities to those who's having exam next week. Okay, so I will reschedule the candidates again, but I will remove the short clinical. It will be only long and long and communication. So all others can practice. Yes, Dr.
Yeah,
Omar, you want to add anything
I think
before?
the take home message for myself
Yeah.
is to um, uh, the big mistake I did. I think
Yeah,
it's
the
the
cancer.
assumption. Yeah, the cancer. Whilst I don't know honestly why I said this, but this is how we react in the exam.
Yes, by the way, more.
Sometimes, sometimes it's although I know 100% that FAB is not a cancer.
Yes.
But Dr. Hisham also is right, and Dr. Muhammad. It's if it's not clear in the scenario, we can tell ourselves that we are not sure if there is any cancerous growth yet or not. Up until this point, further tests might be needed. This is a political way of
Yes, yes.
evading that
You're right.
um, confrontational question from the from the surrogate or the simulator if you ask, is it cancer? Because they can have different way of stating it. So, doctor, do you think it's serious, or doctor, do you think it's cancer? Is it cancer? So it depends on how the question is phrased, you know.
Yes,
Sometimes
you're right.
the question might be phrased like in an interrogating way. Is it cancer? Or do you think it's cancer? So then we can use the uncertainty card, like, well, from what it's written in your result, um, uh, I don't think it's this thing is clear now, but we will, of course, to refer you to, or we will follow this up, or you further test might be waited. I don't know. Is those phrases can be used, Dr. Bassam?
Yes, any concern, please appreciate it first. Yes, I'm so sorry for your feeling. It's something to be worried about. You have to start the answer with this phrase. Then you can answer it. Is it cancer? Meanwhile, it's not a cancer. So use your weapons. Don't be clever in the answer. Is it a cancer now? Did they mention it's a
No,
cancer? So
no.
yeah, actually now on time being, it's not mentioned that it's a cancer. However, there is possibility to be a cancer. Okay, always be neutral and in your answer. Don't give sharp answer. This is a cancer, and no, it's not a cancer, because there is possibility to be either this or that. Okay.
Yeah. Yeah. Thank you.
Yeah. Thank you, Dr. Omar. Okay. Thank you again, Dr. Omar and Dr. Muhammad. Anyone has any question before ending the session? So let's say tomorrow, or see you tomorrow in the long clinical consultation day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.